introduce. Okay.
Good.
So if problem is there, I'll log in with my phone.
Okay, we are live.
Okay.
We are live. We are live. Hello, and welcome to another episode of the Mental Health Awareness Show, where we have open conversations with youth about mental health. I'm your host, KATINDA, NDOLA, the author of The Big Comeback and founder of the Confidence and Self-Esteem Academy, and one of GYMHA's special board advisors. In today's show, we are blessed to have three amazing panelists. And our first panelist is Xavier Sunday Effiong. Xavier is a psychologist and a GYMHA social media coordinator. Hello and welcome to the show, Xavier.
Hi, thank you.
And our second panelist is Deepshika Tripathi. Deepshika is a counselor, life coach, founder at the Priors Trust, project director at the Poonpatham, and also a global youth mental health awareness training manager. Hello and welcome to the show, Deepshika.
Hello, everyone. Good morning, good evening, and wherever you are, good afternoon.
Yes. Now we've got a third panelist, Ibrahim A. Moigua. So we'll just wait when he comes in the show. We'll introduce him. So in our conversation today, our guest will give us some insights on mental health and well-being during the pandemic. But before we do that, I would love to know, how are we feeling today? Deepshika.
Yeah, I'm feeling great to be here and along with such an interesting, as I would say, anticipating topic. Feels really great.
Thank you. What about Xavier? How are you feeling today?
Yeah, I'm feeling great and I'm really glad to be here back again. Thank you for having me.
Great. Fantastic to be back on the show too. Yes, I know we've been on this show for a long while now, and we're all like here, like I'm happy to see faces that I know. And we just, we're here to support everybody, and that's why we do this show today. So we know that 2020, and maybe even now 2021, has brought with it a major shift in everyone's life. And COVID-19 has been introduced to our lives, and life will never be the same again. So how is the coronavirus pandemic affecting our mental health? Deepshika, you want to start?
Yeah, sure. So it's affecting us at multiple levels, I'd say, like psychological level, emotional level, physical level, and emotional level, of course. And apprehension, which is just attached with this, and that fear of getting infected, and about yourself as well, your loved ones, that really creates anxiety among people. But of course, problems are there, and along with problems, solutions are always attached. But I personally believe. And so that if people are mindful and have some insight about how to deal with this, then definitely they can deal. Apart from that, basically, problem is with those people who are already having some mental health conditions due to lockdown and all these social distancing things and all such stuffs. They are getting stressed. So definitely things are there, but support is there, always available. Different organizations as well, people are just in that. They are providing psychological support to people, and they can definitely approach. Most important thing is, it's just that awareness that whenever you feel like that you need support, you must approach and ask for help and just get that support to maintain your balance and equilibrium of life.
Wow, thank you. So what about Xavier? How is the coronavirus pandemic affecting our mental health?
Okay, thank you, KATINDA.
KATINDA.
Coronavirus, I would say, is okay. So I would say that coronavirus has posed so much threat to our mental health and our overall well-being. Looking at 2020, coronavirus has posed a lot of threats to human beings or to individuals in terms of their mental health. The stress they went through, thinking of how things are going to look, how things are going to go with them. if they'll be infected with the illness or with the virus, people had anxiety, fear of being, victim or of losing their loved one, and it's also devastating to their mental health. So we see many people fall into anxiety, trauma, suicide, and other mental health issues. So we said that coronavirus was really detrimental to our overall well-being throughout the year. Thank you.
Yeah, of course. It's we've seen a lot of loss. A lot of people have lost a lot of people. We've seen a lot of people in desperate situations, and at this, I guess, point in time, we that India has really been hit by the COVID-19, and it's actually really a thing for us to look. I know it's gone in stages in every place in the planet, but it's big in India right now. So our thoughts are with you, Deepshika, and the people in India while you go through this challenge like we all did before. Yeah. So what are some health measures that should be taken during the COVID-19 pandemic to protect against the virus?
So
Okay,
yeah,
I think I should
definitely
go
I would
first.
say okay. So balanced diet plays a very important role. Like there must be nutritious diet. One must take that, as well take proper rest, at least 8 hours sleep, because that boosts up our immunity. So in such times, boosting immunity and taking care of immunity is something most important. I would say at most. For that, we need proper physical exercise, proper nutritious diet, sleep, rest, and of course our emotional well-being along with that. And in the times of social distancing, actually social distancing doesn't sound good to people, so to ease up that stress, I'm just de-stressing that from using a physical distancing. Okay, WHO has just replaced this term with physical distancing just to ease up the people. And one need to just stay connected with their loved ones as well, friends and colleagues, so that they won't miss that connection thing. That will help them. And apart from that, definitely all protocols must be followed strictly. That's something most important. Whatever protocols are there via authorities, we must follow that. We must use masks, sanitizers, proper sanitization must be there, and then definitely mask, sanitizer, hand washing, all these things are very important. Apart from that, maintaining our emotional strength. I would say resilience is something most important. This is something which are going to get out all of us from this. We can overcome this with our resilience and emotional strength. And of course, precautionary measures are definitely must be followed. That's my take.
Thank you. Thank you. Hello, hello, hello. We've got Ibrahim on. How are you? We can't hear you, Ibrahim. We can't hear you. Can you check your volume, your sound, your microphone?
Can you hear me now?
Yes,
Yeah.
yes. Now we can.
Okay then.
Hello, how are you?
I'm good. How are you guys? Nice to
I'm
meet
also
you, and I'm happy to be part of the platform to at least share my view about mental issues and how people have been depressed about what is happening around the world, the pandemics, and all of that things around.
great. Welcome. So we were just talking about what are some health measures that should be taken during the COVID-19 pandemic to protect against the virus. What are your views on that?
I think for us to be able to tackle or handle the mental issues or to handle the pandemic in a various society, we need to follow the proceedings, the outlines that already the medical professionals have outlined.
Okay, we can't hear you very well.
It's a network issue, I guess.
Yeah. I think he's frozen. Okay, maybe while we're waiting for him to get unfrozen, we'll go to Xavier. Xavier, what are some of the health measures that should be taken during the COVID-19 pandemic to protect against the virus?
Okay, I think what Ibrahim was about saying, what he was trying to say that we have already pre-established guidelines to guard ourselves against the COVID-19 virus. So here over in Nigeria, we have a drop-down menu for that. We have using sanitizers to sanitize our hands, wash our hands maybe before entering eateries or anywhere. Then we use face masks, very importantly. Use of face masks when you are in a crowded place. And social distancing is very key. You try to make sure you have a gap, some distance from one person to the other. And then gatherings of over 50 people should be abolished. So you don't see yourself in crowded places. And then you try as much as possible to, set yourself from people, from people that you see that are showing some signs of the virus, maybe other symptoms that might show that this person could possibly have COVID-19. So you try to abstain from such people and then have more rest, have more sleep, and then with God, all things going to be possible. Thank you.
Thank you. Thank you. Yes, Ibrahim, we lost you there while you were talking. Did you want to?
Yeah, sure, definitely. I'm so sorry. I think it's the network. But actually, a few of the things that we need to take into consideration that are more virtual. For us, I will consider the ways in which we consider or we try to resolve some of these things that will help tackle into the issue of the pandemic. One of the things we need to do first, we need to accept the pandemic itself. We just need to accept the reality. And for us, who we refer to as educated people or elite, definitely we need to understand, we need to listen and understand. The concept of transforming information is one of the major vital that have caused a lot of alarming issue into this pandemic. If I could vividly recall, when the pandemic itself came, we had a lot of rumor, we had a lot of news around, people saying a lot of things, and definitely we know scientifically they prove today they will give you a result or analysis, and tomorrow again another theological findings to prove what they have already outlined wrong, or maybe something different from what exactly they have outlined. So that's all about science. So one of the things we need to do, we need to accept the reality of the fact that the pandemic is within, and we need to follow the rules and regulation that have been outlined by the medical professionals, which some of these rules are outlined. We need to be following the necessary rules outlined, that we need to maintain social distance. We need to avoid touching your face regularly. When you are walking around or you are moving within the gathering, or even at your workplace or in the public transportation or at your house. Definitely, as we all know, the virus is a flu that flow around, and as they say, some say we do agree or disagree. Some say it's the airborne disease, some say it's not an airborne disease. But despite the fact that remains is, we just need to focus on the necessary precautions. Cover your mouth, your nose, whenever you are sneezing, just follow the necessary precautions. Your armpit here, and like refrain from smoking actively, because these are some of the things that weaken your intestines or your lungs. The pandemic itself, COVID itself, attack your lungs, and it fight within your immune system. So when your immune system is that so weak, definitely you will not be able to function well. So these are some of the things we need to do. And you need to avoid social or public gathering, because you never know where you will contact this particular virus. A large scale of gathering you need to avoid, so because as we know what is happening currently in India and the second wave or the second arriving of the pandemic, we know exactly the immense disaster that it has already caused. And I believe, because I was talking to one of my colleagues recently in India, they are giving me some cynicisms about what is happening. People like really have failed to observe the necessary precautions that have been outlined by the professionals. And there are things, like I said earlier, we need to just accept the reality that the pandemic is existing within us. And if we do that, definitely we'll be able to maintain and triangulate some of these I would say it's a monster or a disastrous spread of the virus around the world. So these are some of the things I think we need to be doing to ensure we tap and end this particular pandemic.
Whoa, that's a lot. That's a lot. I hope viewers, if you're listening to that, that was a lot of information of what you can do as a measure of protecting yourself, your family, protecting the community. Thank you so much, Ibrahim, for that. So just moving forward. So how should people take care of their physical and mental health during coronavirus pandemic? What should they do?
Okay, yeah, like I say, one thing we need to be doing, like to take care of our physical health and mental challenge. One, of course, we need to be physically fit. We need to be physically fit. We need to be engaging on massive exercise when you wake up in the morning, and just do some of your exercises. Keep yourself healthy and energetic. And there are things. Some of us we have a psychosocial impact that has always reaction in us. And definitely, we have been so glued or so contexted with our friends, our colleagues, and in the midst of the pandemic, suddenly they declare maybe house arrest or a coffee, and definitely you'll be isolated. So you need to play along with your mental, having some emotional rest, have enough rest, eat food that will like keep you healthy and stronger, and of course do what you love most, because if you do what you love and forget about the trend or the news around the pandemic, definitely I think you'll be mentally fit and stable.
Right. Thank you. Thank you. Dipshikar, how should people take care of their physical and mental health during the COVID pandemic?
Already Ibrahim has just mentioned more than enough things. Still, I would like to add on something. Yeah, people can definitely use some, if by any chance they get anxious or something like that, they can offer just mindful meditations kind of thing, like mindful meditation as well, resilience, gratitude. These are something, like I would say, pillar of strength, which really strengthens one's, emotionally as well psychologically. So these are something very important. I would say important toolkit. People can utilize it to their advantage, and they can get out of difficult situations. Doesn't matter
Wow.
either it's coronavirus or whatever.
Yeah, so I'm very big on meditation and mindfulness, but also
Exactly.
drinking warm liquids. Like you have to constantly have this warm liquids. Apparently, it's actually just good for you because it keeps you, energetic. It makes you hydrated and keeps you healthy as well. So yeah, thank you. So if you
And
just joined this,
excuse
yes,
me, yeah, I would like to add on something. Taking steam, whether you are getting infected or not, taking steam is something very important. And especially if you're going out due to some reason or meeting with someone, then come home and first just do your rituals and then take steam. That's something very important. At
when
least thrice.
when you say take steam, what
Yeah,
do you mean by
yeah, yeah.
that?
Thrice a day, like just warm water, and if you have vaporizer, then use that. Otherwise, just take any vessel and just warm water in that, and take a towel. I would say a thick kind of towel, and then cover your face up, and then take steam. That will help.
I think also
That,
another thing I'm a big
yeah,
believer and I do is put some eucalyptus oil, like a drop of it, because it's eucalyptus. It's quite good for your,
skin,
not
skin
skin, also for
glows.
your
Actually,
for your nasal as well, because then you breathe better and it
exactly.
actually helps open up your nasal zones. Yes, yes. So if
So
you've just
I
joined
would
us,
quickly want to make some. Okay.
yes.
Yeah, I quickly want to make some addition as to how we will be, like, with or without medication, we're able to like physically and mentally fit. Some of the things we need, I think I forgot, I left it out. We need to like recognize that your anxiety is completely normal. You need to like realize that first, recognize that your anxiety is always normal, and find a sort of distraction. Psychologists know that when people are in chronically difficult condition, it helps you to be divide minded. And when your mind is definitely divided into two categories, and guess what? It will allay your fears. That will help you as well to be mentally and physically fit, because when you have two wrinkles within yourself playing around, definitely you'll be mentally energetic. And some of the things, again, you need to find ways to connect with friends, friends who have, like, like, for me, I do have friends who I do normally contact for them to make me laugh or for them to make me feel happy. So when you're in short state, I believe you just need to contact some of those friends, have fun with them, and you will mentally feel, definitely focus on yourself. You have always wanted to be that kind of person, to learn something. If you are that kind of person, you love reading novels, you just need to focus on your friend and find a ways to, like, really put yourself in the right context, in the right platform, and then you'll be that kind of person. When you are doing something that you love most, we all know exactly how our reactions are, and you need to connect with your feelings. Our feelings are the most important things that help us and that keep us going as people. When I had this philosophy that when you are mentally disturbed, even your emotions or your reaction to your body definitely all dies down. When you are mentally disturbed, your immune system will be totally devastated, and you feel yourself, you touch your body, it will be so cold, your body will not be at the normal state. So you need to be more concentrated on the normal feeling or connect to your feelings, and that will allow you to move along. And be kind to yourself and others. It helped you a lot. Earlier when the pandemic came, I would cite a scenario about Africa here. Family have becomes divided, friends have separated, relationship have gone apart because of the COVID. People just don't want to accept the reality. If one thing we need to know first, before COVID, there has always been normal illness or normal diseases that are affecting us, like the severe headache, chronic malaria, jaundice malaria. We have some of these things that react just like COVID itself. And when it came to Africa, people just fail to adapt to the system, and they start to have some hiccups. So one thing you need to do, you need to be really kind to yourself and others, because if you accept the situation of other people and then treat them immediately, definitely it will be able to help you. Because now the rumor we are going around, thousands of people are dead, millions of people are dead. You start to think, when will it, you start to think, oh, it's gonna be next. I'm going to be on the next drive. For those of my friends now who are in, like, the hotspot center, like India and America, you just start to think that you are next. You have nothing to think about, like, the state I'm in currently. Anything can happen to me, and you will not be mentally stable. You will not be definitely mentally stable. So you have an effective way to prioritize that and be mentally fit with some of the.
Okay, I think we lost him. Now, Xavier, did you have something to add on this one? How should people take care of their physical and mental health during the COVID pandemic?
Okay. I was really learning from what he was saying, from what Ibrahim was saying. Actually, first, I think he mentioned that people should be really people should be made to be aware of COVID-19 pandemic, the virus itself, its mode of transmission, and how it's people can get in contact with it. So when people are fully aware of this, they actually get to know how to cope with the issues or with this virus when it comes to existence. So I think, as I already said before, the federal government of Nigeria has already pre-established guidelines to safeguard us from contacting the virus or dealing with the virus if contacted. So firstly, we have to use sanitizers, use of face mask, when we are at crowded places. Then social distancing is very, very important. When we gather places more than 50 persons, we should try as much as possible to distance ourselves from one person to the other. Then use of nose mask, as I've mentioned, is very important. Then what else should be there? Okay, I think that's all for now.
Okay, that's okay. That's okay. So if you've just joined us, we're talking about the mental health and well-being during the COVID-19 pandemic. Please click, share, comment, and invite your friends to watch and ask questions, because we are here to inspire you, to enlighten you, to give you some insights about mental health, how we get affected by different areas of life. And today's was mental health and well-being in pandemic. So, moving forward, what are some ways or some effective ways of dealing with the COVID-19 pandemic anxiety? I know we talked
Okay, I
before
think,
about mindfulness and, eating well, sleeping well. Is there anything else people can do?
yeah, there is. I think
Yeah, they
I
can
should go. I
just,
should go.
yeah, sure. Afion, carry on.
Okay,
Savior.
okay. So when we talk about anxiety, we actually know that there must be an anxiety stimulating situation. There must be a particular cause of this anxiety. So in the case of COVID-19, the news alone is enough to cause anxiety or to elicit anxiety in humans. So as a way of curbing this, it's very important that we abstain from this news, from hearing this news of COVID-19. People are dying in India, people are dying in Nigeria, so thousands are dying per day. So when we continuously listening to all these things, it breaks down us. It's very detrimental to our mental health. So the good thing we should do is to stay away from this news. Put off news for some time. Focus on other meaningful things that could bring better things to yourself, things that could bring you joy, maybe family, maybe work, maybe learning a trade, or maybe going to learning a particular skill. Maybe people that you don't know how to cook, you can actually go to learn how to do that. So those things, by doing those things, it will actually, push your mind away from the incidents of COVID-19 and all the rumors, fears that surrounds it. And by then you'll be having a very perfect life. Thank you.
Thank you. Deepshika, what do you believe are some effective ways of dealing with the COVID-19 pandemic anxiety?
I would say that instead of the things which we can't control, focusing on such kind of things, we need to focus on things that's under their control, like the things which we can take control of, like our routines, our well-being, as well our diet, our care for our loved ones, as well just contributing in some way to community, to people around us. That really gives a great sense of purpose, and that boosts up our sense of self, and that really helps. I would say that's kind of just that emotional boost up, and emotional, physical, as well emotional detoxification is sometimes very important as well. Digital detoxification, like there are various news, it's like flooding, corona pandemic deaths and just infected people, these that datas and all such things. So that really just that just I would say grows anxiety in people, you know that just that uplifts that anxiety, and that interferes with their health, mental, emotional, physical, every kind of health. So that's something very important. We need to detoxify ourselves in between, so that we can maintain that equilibrium, and then definitely we can get back to our that digital world. But times being, we need that detoxification for
Yes.
our well-being, definitely. And then one need to trust only trusted authorities information, not each and every information. Like there are lots of information, so you need to just trust on information from sources which are valid, which are authorized, like WHO and these kind of organizations, not on any and every information. That's not required at all. And the basic protocols needed to be followed, and then things, something are there which needs to be taken care of, our health, our well-being, precautions. And most important, doesn't matter whether you get infected, even if you get infected, it's not that horrible, because I'm already COVID survivor. I just got infected and fortunately recovered. With my family I got infected, but definitely with necessary precautionary measures we have taken, and that emotional support was there, we have recovered. So nothing to worry. Even if you got infected, just need to take care of your health properly. And in these days, I need oximeter is something which all of us need to keep with ourselves handy, so that we can check our oxygen level and everything. That's something very important. These are practical measures which we can take care of on practical levels. These are small simple things which we can take care of, instead of worrying about those things, just viewing those death tolls and infected people graphs and all that. We need to take care of things which we can control. So
Thank you.
that's my
Thank you.
take, I would say. Yeah.
Thank you. Thank you. What about Ibrahim? What are some effective ways of dealing with COVID-19 pandemic anxiety? What would you like to add to that?
So definitely, one of the effective ways we need to treat stuff is like we, like I said earlier, we need to like find a means of distraction. You know, psychologists has always declared or known that when people are in chronicle difficult condition, it helps to divide their problems into two categories or their mindset into two categories, which help them a lot. And secondly, for us, the elite, that have got this, I would say, got some amount of education, and which we think we can use that as a tools to degrade or downgrade other people. Because in an instance, I've seen in an instance where someone putting up a face mask and the other is not putting on a face mask, and seeing the same person going through the somatic moment, instead of the person to help him, definitely he deviated. He never tried to understand exactly what is the problem or what is the circumstance this particular person is going through. It doesn't mean that when someone is in a critical state or in a critical condition, he or she is going through the corona or the COVID itself. You know, instead of you to help the person, you just deviate yourself from the person. Imagine you are a close friend to this person. Exactly, you have automatically made this person to look like someone who is not even worthy or who is not even fit to be part of society. You know, we need to understand, we need to be good listeners, and instead of we being listeners to solve problem, let's be listeners to provide solutions to problem. You know, we should like have this kind of commotion wherein we accept situations and challenges that comes our way. You know, one of my friends was sharing a video with me wherein he sent a video, and the video, it was Bill Gates. Bill Gates declared he was. I literally I felt myself. I accepted it. Bill Gates made a statement that the world is so much and highly populated, and he declared that we need to reduce the population of the world. He mentions Africa. He mentions India. He mentions China. That there has to make a solution, or there has to make something that will reduce the population of this particular continent. And he made a particular statement that Africa is populated and they cannot even take control or proper care of themselves. You know, as an Africanist or as a Pan-Africanist, that particular word gave me grief, and I was mentally disturbed. You understand? I was just thinking out to myself, I was thinking, if I had the chance or I had the opportunity, I would just meet Bill Gates in person and and assassinate him because of that particular statement. So I was like mentally inferior. So the manner and ways in which you accept informations drive off to some of the problem. So we know the propaganda about corona itself or the pandemic itself, it's all over media, and there is no amount of information that will allays our fear. So today you wake up, they will tell you India have lost 2,000 people, have already dead. China has lost 3,000. America have lost 5,000. So you will start to imagine, where are we heading? Where are we going? So the amount of information that the social media handles, definitely. So one of the ways we need to address that, there has to be a proper education about the pandemic itself. People need to understand the pandemic, the circumference of the pandemic, the way and manner in which it affects people. We need to have a good knowledge about it. So one of the ways we need to do education about the pandemic. People need to accept that the pandemic is ongoing. And secondly, we need to take the information or the education about the illness to the community, because people are not well informed about this particular pandemic. You know, I was talking to a friend in Dusa in India, I don't know, and like they are not even considering, despite they are in a hot state, They are not even considering that the pandemic is existing within that continent, and yet still people are dying every day. I was talking to them, do you heard about this? Are you getting some information? So they are not properly informed. So people need to be properly informed. The psychosocial results of this particular pandemic is really negatively on the mindset of people based on the information they receive, based on the information they gather. So definitely, one of the key ways we need to tackle or handle some of these things, people need to be well informed about the process.
Thank you, Ibrahim. Okay, so moving forward, what are some ways to utilize the pandemic constructively? What are some ways? Because we are here now, we've got the pandemic, we've got the fears, anxiety, the mental health. Okay, so how can we turn this into a positive thing and do something positive? I know, Ibrahim, you're talking about people have to accept what is going on. Yes, acceptance is critical. But then how else can we utilize in a positive way what is happening to the planet?
And here I would like to share.
Go for it.
Yeah, sure. So just along with that, awareness and acceptance, people also need to think about what could be done, what could be, what could best possible done in such situations to enhance themselves emotionally and physically, intellectually, at every possible level. Like, for example, students can take lots of internships. Nowadays, online internships are there. Then professionals can go for internships too, or different sorts of training programs and etc. Since at the comfort of their home, it's like never before. It was not so easy. Now information is accessible, help is accessible, training is accessible, internship is accessible at global level, like never before. So, of course, crisis is there, but definitely along with this crisis, there are opportunities are there. So, kindly just take someone else. Let me just put it in charge. I'll add on my points here.
No problem. Thank you, Xavier.
Yeah.
Xavier, what are some ways to utilize the pandemic constructively?
Okay, I will say that the pandemic is a two-edged sword. It brings both the good and the bad. In the other side, it brings disadvantages to humans, whereby it brings the plague or the pandemic or the virus to humans. And then in the other way, it brings good times to us. Considering some families where the husband and the wife, they go to work from Monday to Sunday, or from Monday to Saturday, and then from 4 a.m. to 8 p.m. at night, and then they don't have time to talk. They don't have time to make things out. They don't have time for each other, for their children, and for the family. So pandemic or the total lockdown that exists in some places, it's an ample opportunity for couples to be together and amend things in their family. It's an ample time for children to really spend more time with their father and their mothers. So it's also an ample time for husband and wife, to settle their indifferences, of which they wouldn't have had such time to trash that out. So it's really, really important. It brings in so much opportunity for peace to happen in the family. Thank you.
Yes, Ibrahim, what would you like to add to that?
So I think they have almost said it all, but I'll add a few things. One of the things we need to do, we need to change the culture about mental health. The culture, the narrative in which we look at the mental health itself. People fail to realize, instead of we accept mental health as normal, something that lives within, instead we accept it as a disease that's live within community, and which is very wrong. Mental health, it's something like can be normally devastating when someone is going through a mental liberation, going through some traumatic pressure, going through some tedious thing that has caused him like a depression, maybe violence from different angles. So one of the ways we need to accept that mental health, it's a normal routine, instead of we looking at it in the perspective of being a disease. People get themselves isolated for someone who is mentally disturbed. People get themselves retreated from someone who is mentally ill. You understand? We fail to accept them. And secondly, we need to be respectful for each other. You need to have respect for each other. Like I said earlier, just what Xavier was saying, you know, people normally don't have time for each other anymore. In the midst of the pandemic, you just think everything is okay all by themselves. People isolate themselves. And when you isolate yourself, you fail to triangulate or articulate with other people, associate with other people, you get yourself mentally into. You understand? You get yourself into something that you don't want to be part of. So these are some of the things we need to be doing. And we need to be constructively listening. We need to be constructively listening to understand instead of us constructively listening to respond. You know, these are the things that the medical people are failing to understand. Their own major concern is for them to just receive a call. Hello, yes, there is a case over here. Right away, they took an ambulance, go there. With all of those atmosphere, people will become mentally disturbed. People will become mentally unstable. If I'm in this area now and the emergency response arrive with their team, with a bulk of team, the ambulance all over coming out with the steering, everywhere, people will be mentally unstable because guess what? Instantly they will start to think, maybe I'm going to be the next person. Now the information about the pandemic says it passed through flu, airborne, and whatever. People just think if there is a case now here, people will start to react to this particular thing. And guess what? There are eligible people who normally react, their health system normally react to system. And if now an incident like that occur, definitely they are going to respond with that particular anxiety over them. And guess what? They will be the next person to be called for because their pressure, their BP, their temperature will shoot up automatically with the kind of response that the medical people react to. So we need to be very responsible and constructively listening to understand instead of we constructively listening to respond to situation. I think these are some of the things we need to be doing. One, we need to accept the disease itself within and rather the mental stuff within instead of classing it or referring it to as disease or something that is more disastrous to human nature.
Thank you. And so how would we maintain emotional closeness in times of social distancing? What do we need to be doing? I know we need to have more conversations at home. We need to play more games like Monopoly or cards or anything like that. But what are your thoughts?
We can play with
Okay,
our
I think I
friends. Yeah.
can.
Xavier, you can go ahead.
Go on. Okay, no problem.
Xavier.
Thank you. Okay, we can't do without friendship. We can't do without communication. We can't do without staying in touch with loved ones. So I'm really grateful for social media. I'm really grateful for internet. You know, it's an ample opportunity where we could always get in touch with people. So I think it's really very important that we utilize, you know, the social media, you know, the visual world, using of chat box, WhatsApp, email, messengers. I think messages to communicate, to stay in touch with others. You know, when we are constantly communicating, exchanging words, you know, with others, we stand a chance of, you know, losing some negative thoughts, negative feelings, because just we are talking to, they can actually make us smile in their words, maybe crack jokes, and then we actually forgetting some bad moments, and then still being in touch, and then still have some sense of belonging. So I think it's really important that we embrace the visual world. We embrace, you know, WhatsApp. We embrace video calls, where we could still be seeing those people and then be conversing with them rather than physical contact. Thank you.
Thank you. Tipshika, what would you like to add? How can we maintain emotional closeness in this with times of social distancing? We can't hear you. You've got your microphones muted.
Okay. So thank you. So I would like to add on here, so first of all, we need to replace this term social distancing with physical distancing so that we can de-stress our people a little bit at least. Because there's a difference in social distancing and physical distancing. And of course, it's more of a physical distancing than social distancing because we can connect socially. Internet is there, digital devices are there, video calls are there, Messenger is there, Facebook, everything is there. If we need to stay connected with people, we can. And apart from that, if we want to support community, our people, we can support them. We just need to look ways in which we can support them. Either it can be just creating awareness or psychoeducating them, or I would say just extending some help, whichever is possible via online. And then in our societies, like neighborhood, we can just check in, like whether you're all right, do you need any help? That's enough for giving that emotional well-being sense or emotional fulfillment to others. That's really a great thing, yeah. And altruism is something I would like to add on here. That's something most important. Contribution. Whatever is possible for a person, that person must make that contribution to community in these difficult times. That is needed. Something most important. Something most important. It's not always about finances or medical things, or it's about emotional support. At least we can support each other emotionally, and that's completely free of cost, and that's really going to help each one of us. So that support can be extended.
Thank you.
Globally.
Thank you.
Yeah, that's
Thank you. Ibrahim, do you have something short to add just before we conclude the show today? You've
Yes.
got your.
Yeah, so one thing I think we need to do, a lot of people believe in their spiritual leaders. These are some of the things we, I think, trying to lacking behind. So many people believe in their spiritual leaders. Some have their icons, their gods. So I think they are the best who can advise some of us, and then for us to end our anxiety about the issues of the pandemic. And second is therapy. A lot of people are working in the front line of the pandemic, or they are frontline workers, and they don't have even confidence in themselves. Some, whilst even being admitted to hospitals, still they don't have the confidence, they don't have the belief that, oh, we are going to make it out of here. And as a frontline worker, I'm not going to make it through. If my colleague or a doctor who is more professional than me has already gone, definitely. So these are some of the things we need to work on. And then people need to abide by the rules and framework of the pandemic, and which I think we'll be able to end all of those stuff.
Thank you. Thank you. Yeah. So before we conclude, I know there's so many ways to protect and manage your mental health and well-being. So what is one thing you do for yourself on a daily basis to check in with your mental health and to soothe your soul? We'll start with Ibrahim.
What? Come again?
So what is one thing you do for yourself on a daily basis to check in with your mental health and to soothe your soul?
So one of the things I do, I love music so much. So whenever I'm stressed up, I'm like mentally disturbed somehow, I go into the music world. And my second choice, I do play football. I think these are some of the platforms that I think it gets you going. So I'll be in my house, and then I'm trying to do my little stuff, play along within the compound, and keep me healthy and very energetic. I do my squats and do my running around the compound and every day, I think. After which I have someone who normally come and check on my system to see whether I'm being fit and being up prudent to go. So these are some of the things I do. I do sing music a lot. Yeah.
Thank you. Xavier, what is something you do for yourself on a daily basis to check in with your mental health and to soothe your soul?
Okay,
It's
Charlie,
in
I
my
do a lot of
network,
things
right?
to.
My
So I'm
audible.
gonna share two of those. Okay, so the first one is that I make sure that I am always in charge of my emotions. I'm always in charge of what
Are
gets
you
to me
hearing me?
and what doesn't get to me. Like I don't just allow what someone could say or someone will say will just get to me straightly. For instance, it might just start abusing me or saying negative things against me. So I will just overlook that and go my way. I won't let that get into me because by the time you start pondering again with that or thinking that you're gonna have some negative feelings getting into you and some negative emotions, and thereby that might possibly put me down to depression. So I really channel and know what gets to me. So the second thing I do every day is that I prioritize my task for the day. I set out things, the roles I'm going to play for the day, things I'm going to achieve. And then it's not a must to achieve all these things daily. If I'm able to have 60% of them achieved, that's fine, because I know that frustration is very, very detrimental to our health. So those are the few things I do daily to make me do it. Thank you.
Thank you. Thank you. Deepshikha, what is something you do to check in into mental health and to soothe self on a daily basis?
I just use yoga, meditation, gratitude, mindfulness, and apart from all this, at utmost, I use contribution. That's something that suits me, which strengthens me, which heals me. And the possible ways in which I can contribute to community, to society, to my family, or in whatever way is possible in present scenario. I just go to do that beyond my limits, and I love to do that. And
Thank you.
I inspire people for doing that, because that gives great sense of self and sense of purpose.
Thank you. Thank you. Now, if you're watching this show, you can find more information on the Global Youth Mental Health Awareness by visiting our website, www.globalyouthmentalhealthawareness.org, or you can email Jude, Jude, at GYMHA.org. So where can people find you? Would they find you in the names on the screen, or do they need to go somewhere else with different names? Your social media, the names that are appearing on the screen.
Just names appearing on the screen.
Okay,
they can find us.
Xavier, so your name that's appearing on the screen is where people can find you as well?
Yes, please.
Yes, what about Ibrahim? Are the names on the screen the place where people can find you on social media?
Yes, you can use that my name, only the HE, because the HE has just been added by my colleagues. And then I think it's Ambassador Ibrahim Alpha on Facebook, and on Instagram is Ambassador Moigua, and Twitter is the same Ambassador Moigua, and then on link is the same HE Ambassador Moigua.
Okay, so I think what I would suggest is put that on the Facebook chat once you finish the live, so people can find your information easy as well. Just type them in there. So thank you so much, Xavier, Deepshikha, Ibrahim, for sharing your insights on mental health and well-being in pandemic. I want to thank you, viewers, too, for being a fabulous audience and for watching the Global Youth Mental Health Awareness Show today.
Yes.
And now in the next fortnight, our topic is self-awareness and mental health. Until next time, may you all experience the frequencies of love and light. Stay blessed. Bye for now.
Bye, everyone.
Bye-bye.